We're going to talk about lightning injuries for a moment. Lightning injuries are probably not something that you will see a lot of. It's certainly something that you need to know how to treat when you do see it. Lightning flash occurs about 8 million times a day throughout the world. Just some statistics we're going to talk about, and obviously lightning is one of the leading causes of weather-related deaths. And unfortunately here in Alabama we're in a band that includes several of the southeastern states, Alabama, Florida, and Georgia, but also North Carolina and Texas, Missouri, New Jersey. Those are areas that have a lot of lightning strikes. So we may see some lightning injuries in Alabama that again, it's not something that we see a lot of, but it's certainly something that you need to be familiar with to know how to treat those. Males are 5 times more likely to be struck by lightning, and lightning injuries are not always outdoors. That was something, as I was preparing for this, is something that was really surprising. According to the CDC data, about 32% of lightning injuries are indoors. And something that was interesting that they talked about was that EMS dispatchers are those that are one of those populations that you see more lightning strikes indoors. And the reason for that is when they started doing EMD, and they had hardwired headphones to the radio console, you saw more and more not only EMD but emergency medical dispatchers that were getting lightning injuries from lightning and electrical transmission, electricity and transmission from the radio console into their headset. And I know a lot of those are wireless now, which is not going to be a problem, but that was something that was really interesting. People are in the shower, people are on a landline, people are using the toilet. Those people, the plumbing can transmit electricity from a direct hit to the home. Also with the telephone lines and electrical lines. So we've always been taught as kids, don't use the telephone, don't get in the shower during a lightning storm, during a thunderstorm, and that is entirely correct. But I thought that the idea that there were more lightning injuries once we started using the wired headsets to a radio console on the emergency medical dispatch arena was certainly something that was interesting. Lightning, if you remember electricity, we talk about alternating current and direct current. Electricity, in the house is alternating current, and then lightning has always been thought of as a direct current. You just get a direct hit. And some people are even talking about that it's not necessarily a true direct current, but lightning has its own unique qualities, and some people even describe the direct current that you see in lightning as a cosmic direct current. So you may see that term from time to time. Nevertheless, it's not an alternating current, it's a direct current. Studies have shown that it's 100 million to 2 billion volts when you get hit by lightning. And the heat generated by lightning strike is anywhere from 15,000 to 60,000 degrees Fahrenheit. And for those of us who have seen lightning injuries, we can almost always say, yes, you see some burns, but 60,000 degrees Fahrenheit, you would think a patient would be incinerated, but they're not. Many times they don't have a lot of external burns as far as gross burns. And the reason behind that is that it is so short-lived. That lightning is a direct hit, and it's a tenth of a second. So you don't get that gross burn incineration that you would usually get from 60,000 degree Fahrenheit exposure. All right, so what about injury patterns and physical findings with lightning strikes? Because of the sudden discharge of energy from a lightning strike, it causes muscle contractions. Those can lead to fractures because it's just such a gross and high muscle contraction that it can break bones. The other things is it can throw the patient. You get pelvic fractures, head injuries, cervical fractures, etc. from being thrown, direct current because of the muscle contractions. So high index of suspicion of major trauma when you respond to a lightning injury. It can disrupt the normal central autonomic and peripheral nerve systems. Central nervous system, it can basically wipe out the cardiac and the respiratory center and the medulla. So it can cause you to go into cardiac arrest and cause you to go into respiratory arrest. I'm going to talk about that in just a few moments. Autonomic nervous system is very similar to the central nervous system. Again, as far as the disruption of the cardiac and respiratory centers. From a peripheral nerve system dysfunction, not something that we see in the field initially, but something that you may see. They just have chronic pain and sensory disturbances that are usually long term. So that's not something we really deal with. I think the issues that we deal with are the central nervous system, autonomic nervous system, no cardiac activity, no respiratory activity because of that direct current on the brain. So we're going to talk a little bit about cardiac arrest and what to do in lightning injuries. Cardiac arrest is really rare in lightning injuries. Does it happen? It absolutely happens, but it's really rare. When it does happen, though, that's usually the cause of death, is a direct cardiac arrest rather than a trauma or a central nervous system insult, direct lightning strike on the brain causing a stroke, etc. So when a cardiac arrest occurs, it's usually the cardiac arrest that is the cause of death rather than a traumatic injury. Usually what happens in a lightning injury, because of that direct hit, high voltage, it causes a massive electrical discharge in the heart that causes asystole. That's usually what happens initially in a lightning injury. You get asystole. And that's because, again, we talk about this direct current just basically overwhelms the normal electrical activity of the heart. But also because it affects the medulla of the brain, it affects the respiratory center of the brain. So we get asystole on the cardiac side. On the respiratory side, we get apnea. That apnea can be prolonged. Well, that cardiac asystole that you see, many times because of the inherent automaticity of the heart, that heart will recover itself, and it will recover itself quicker than the respiratory side will recover. So if you don't start breathing for those patients, they will deteriorate into VFib. So sort of explaining that again, cardiac arrest usually asystole to begin with, respiratory system is not really letting them breathe, and if you don't do something fairly quickly, then that cardiac asystole, although it will recover momentarily, then you will deteriorate into VFib. And burn pattern sometimes in lightning injuries is what we call a feathering, and you'll see just almost like a fern pattern. That's pathognomonic for lightning injuries, and that's just because of electron shower. All right, so treatment. What do you do for lightning injuries? Obviously, high index of suspicion. Worry about the traumatic injuries. Like I said, these patients can have cervical injuries. They can have pelvic injuries. So immediate spinal immobilization, immediate CPR, and airway management, bag valve mask, ET tube, King airway, etc. One thing that we have found is that when that patient goes in asystole initially, heart sort of recovers. If you can start breathing for those patients, many times those patients will recover and they won't deteriorate into VFib. And one thing that you have to keep in mind with lightning injuries is we do what we call reverse triage. If you remember in a mass casualty incident, someone is not breathing, they don't have a pulse, they're black, and we don't resuscitate those patients. We need to think just the opposite in lightning injuries. Many times these patients will recover, but again, you need to try to breathe for them to keep them from going into VFib, because once they go into VFib, they very well may not survive. So if you can get them pretty quick, when that heart is in asystole or that heart starting to recover, you can start to breathe for them. That heart's going to become less ischemic, and keep them going into VFib. So reverse triage, that's a sort of a buzzword for lightning injury treatment. Again, immobilized suspected fractures. Many times you arrive, they got clothes that are still smoldering, depending on how quick you get on the scene. Get those clothes off. You have jewelry on them, necklaces, rings, etc. that may be smoldering. Try to get those off. Many times that's hard because that jewelry is embedded in their skin. But if you can, get them off. IV fluids, assess their blood pressure. If they're recovering, their mentation. Check for basically any type of injury. Keep in mind that if you look back to some of your training, one of the things you look at for assessment of shock is mottled skin, cyanosis of the fingers, etc. That may be normal for a lightning injury because they have arterial spasm. So look at that blood pressure, look at that heart rate, look at their mentation if they're recovering, and then transport these patients to definitive care. We don't really get into that chronic treatment that they will have, but just keep in mind that as months and years occur after lightning injury, these people can have personality changes, they can have neuropathy, etc. So some take-home points from lightning injuries: one is reverse triage. Number two is that cardiac event is usually asystole, and the cardiac system, the heart will recover quicker than the respiratory side, and you need to start breathing for these people to keep them from deteriorating into VFib. And again, feathering or fern-like pattern on the skin is pathognomonic for lightning injuries. Thank you.